Why do these treatments not address the underlying problem? Why do people still end up having those problems, right? And we think about it like a vehicle, right? If we think about it, a vehicle that with a nice alignment of those tires, that tire is going to wear nice and evenly. However, if we have structural misalignments where we get a torsion or that knee starts to track wrong, we have a trauma, or we can start to develop muscle imbalances, or maybe we're carrying so much weight where that stress on that joint is simply increased. What happens is, just like a vehicle with a tire gets knocked out of alignment, it's going to wear abnormally. And that's why you typically see that degeneration on that once on the inside of that knee. Again, that kneecap, the joint, the bottom part of that knee starts to rotate to the outside and then starts to track wrong. So we have this misalignment of the knee joint, many causes for that. Again, muscle imbalances, excess stress on that joint, right? Chronic inflammation, insulin resistance, right? Excess weight and obesity can be a big thing. So insulin resistance will cause those joints, literally every joint in the human body, to wear out faster if we're chronically exposing it to higher blood sugars. Chronic inflammation, if we're chronically inflamed, this is where we get into some of the food and nutrition in our office, as well as some of the treatment. The treatments are actually designed at normalizing inflammation and directing it towards healing the joint instead of just creating chronic pain. Excess weight and obesity, right? So increased stress on that joint just because we're carrying around extra weight. And that's one of the big things we talk. If we can get rid of inflammation, insulin resistance, and reduce that weight, that's going to play a huge role also in helping you heal.